This original WSRE presentation is made possible by viewers like you. Thank you.
Healthcare costs take a sizable chunk of our country's and our personal budgets. What can we do about it? Good evening, I'm Lloyd Patterson, and tonight we're going to take a look at why healthcare costs are so high and what can be done to reduce them. In our studio tonight, we have Pensacola neurosurgeon Dr. Troy Tippett, president of the American Association of Neurological Surgeons. We also have Todd Torgerson, president of Combined Insurance Services in Pensacola. David Apple, owner of the Apple Market, a local business that offers health coverage to its 80 employees. And by phone from Tallahassee, Bruce Rubin, president of the Florida Hospital Association. Welcome to all of you. Thank you for joining us to talk about this very important topic. Dr. Tippett, let me start with you. How do you, from your perspective, did we get to the point where we're spending so much of our nation's wealth on health coverage, health costs?
Well, it is a huge question, but I think there are a couple of things you can mention. First of all, we've gotten away from personal responsibility in this country, in which you are responsible for yourself. You've had other people intervene, whether it's the government or insurance companies, between you and your physician to make joint decisions. That's one very important thing. And another thing is, I think we can't assume that just because we spend quite a lot of the nation's wealth, it's not a worthwhile expenditure. Many people say as nations become more wealthy, they spend more money on health care, and that's quite appropriate. So those are two issues that I think that fit into this picture.
Todd Torgerson, what about you? Why do you think, how do you think we got in this position?
Well, I think a lot of it has to do with how people look at and view their health insurance plan, how they access health care. If you take a look at the average employee that's enrolled in a group plan and you say, well, what did that physician visit cost you? They'll tell you it was $30. And you say, no, that was the cost of your copay. What was the cost of the visit? Which could have been $200. So we're very much insulated from the real cost of care. Right.
And we have Bruce Rubin on the phone, president of the Florida Hospital Association. Bruce, what do you think? I know it's asking a lot, but how do you think we got in this position today? Go ahead. Bruce?
Yeah, I'm
okay,
back.
Go ahead. We have you on the phone right now. How do you think we got in this position today where we spend so much on health care?
Well, we're a very big country, and we're a wealthy country, and over the years we added government programs to cover the elderly and the poor, and that pours a lot of money into health care, and so we've got the largest, most robust research and development part of health care going, and it's a very important part of people's lives. And so we've put a lot of our country's treasure into restoring health.
Right. Todd Torgerson mentioned something a moment ago about most of us, our interaction with our doctor and our insurance company, we go to the doctor, we don't care what the doctor charges, but if I'm buying a car, if I'm buying anything else, man, I want to know every detail. And you think that's got a lot to do with it, that most Americans have no incentive in getting lower priced insurance? If they get covered, they're happy.
I think you're absolutely correct, and that's why things like health savings accounts are so good, because they do put the patient and the doctor back in the same room and don't have a lot of other people in there deciding how much money they spend or whether it's a good idea. The patient gets to talk with the doctor about, should I spend money on this test, and it is a reasonable expenditure. So you're absolutely correct. We do need to get the other people out of the equation. I think we can save money if we do that.
Bruce Rubin, what about how do you incentivize this system, make people care what health care costs?
Well, obviously, if they're paying out of pocket, they're going to be concerned about what they're paying, and third-party payment does insulate people from the cost of care. But I think the way to directly impact the cost of health care is to make sure that we pay for what we want to get. In other words, that we move away from paying for episodes of care or specific services and move towards paying for better outcomes and for high standards of care.
Okay, very interesting. Todd Torgerson, more on the incentives?
Well, I to some extent agree with what he said. I do think that people need to take advantage of what's there. Most of the insurance plans that we have in place today have a good wellness program. People won't take advantage of it. We're seeing our larger employers put carrots and sticks into their plans to get people to participate and to pay more attention to their health. But back to Dr. Tippett's comment, to build on what he said, it really today boils down to more personal accountability, and people have got to connect the dots between their own insurance cost and their own health cost. And that's where the schism is today.
Well, one person who deals with health care costs on a daily basis, and it makes up a big part of his business, is our guest, David Apple, the owner of the Apple Market in Pensacola. He has about 80 or so employees. He offers health insurance. Now, how has this insurance, the increases, how have they affected you and your business and your employees?
Well, over the course of the last 10 years, we've seen almost 100% increase in healthcare costs. And of course, we share those expenses. The employee and the employer pay a portion of that healthcare cost, and we have seen the cost per policy basically increase by 100% or almost 10% per year over the average the last 10 years. And we've come to a point now where as our business has grown and we've added more employees to the policy, that we're looking at, well, we've got to make some cuts somewhere. And so one of the things that was just a practical nature that we had to do recently, rather than cutting out health care, which is not only a tremendous employee benefit, but a necessity really in today's market and country. We are, well, at least we feel that way, that we need to be able to provide that for our employees. We're looking at cutting vacation time, and we're looking at cutting contributions back to other employee benefits like 401k plans in order to provide the priority benefit, which we feel like is health care, and our employees feel like they would rather have their health care plan contributed to than their vacation time or even their 401k plan.
A lot of young people aren't too interested, or they're not that much concerned about health care, the insurance. They have very little interest in paying something when they can use that money for something else. How do you get younger people to see the wisdom of signing up and contributing?
Well, we make it available to everyone, and many young people, of course, covered by their parents at college age, but we just simply talk to them about it. We talk to everyone about the necessity of care in the event of the unforeseen, in the event of an automobile accident or an emergency or something like that. And so we just try to communicate with them as best we can, young people particularly. When they become eligible, they're not on anyone else's plan.
Let me ask the rest of you to help here on David. Do you think that the country ought to force young healthy people to get health insurance? Would it make sense to you?
Well, personally, I'm not too excited about mandates about most things, and that's a mandate. You've always got to look at what's the punishment going to be if they don't buy the insurance. They just say no. Are you going to put them in jail? Are you going to fine them? Are you going to charge their income tax? I mean, how are you going to say you've got to have insurance? So I am concerned about a mandate that makes these young people have insurance. I would certainly encourage them to, and I'm certainly for everyone having insurance. It's just, how do you implement that realistically speaking? I think it's difficult.
Bruce Rubin, Florida Hospital Association, it would probably be helpful to hospitals if they knew that every person who came in had insurance coverage, wouldn't it? Young people, old people, everybody.
Well, more importantly, it would be helpful to those people. The Florida Hospital Association hasn't taken a formal position on an individual mandate, but I really don't see how we get to the point of getting everybody covered without it.
Okay, so you think it's something that's really has to be done if this whole thing's going to work?
I think we have to get to the point where people exercise personal responsibility, and that is personal responsibility in the same way that everyone should carry car insurance. You know, we expect drivers to have insurance. Some people will not live up to that, will violate that requirement, but for the most part, people do it because they know they have to.
Todd Torgerson, you think young people, everybody should be mandated to carry some coverage, health coverage?
From my personal background, I really disdain the thought of a mandate, but my experience tells me that's really about the only way we're going to get there. I've sat through many an open enrollment session where the employer makes it such where the cost of the insurance is only, say, $5 a week to have, and the employees, particularly the younger ones, will refuse to buy it. And it just happens to be those same employees that have $5 a day sitting in their front pocket with a cigarette logo on the top of the box.
Right.
So they're spending $5 a day on cigarettes, but won't spend $5 a week for health care. And they show up at Mr. Rubin's hospital needing care, and they get it.
Right, and it's going to be paid for by somebody, and that's one of the things we want to talk about in this program this evening. If you just joined us, this is Connecting the Community. Tonight we're talking about health care and insurance and coverage and how much it costs. We have a great panel here with us tonight. Dr. Troy Tippett, a neurosurgeon in Pensacola, president of the American Association of Neurosurgeons. We have Todd Torgerson, who is president of Combined Insurance, so he covers that angle of it. And David Apple is owner of the Apple Market. And of course, business owners play a big role in this too. They're trying to provide coverage to their employees, and it's tough to do these days. Of course, by phone we have Bruce Rubin, president of the Hospital Association, and we hear a lot from hospitals talking about how they're going to cover all these expenses. People come in. You can't throw people out in the street, can you, David Rubin? I mean, they've got to be taken care of.
Well, there's absolutely there's a federal law that requires that any person who presents themselves at an emergency room in need of care needs to get that care. So hospitals can turn no one away.
Right, and the bill still has to be paid. Your nurses, your doctors, administrators, they still probably like being paid, and so they don't do it as a charity case, but the hospital has to.
Well, look, the whole system has to provide care, you know, when a person can't pay, unless it's some elective service. So if someone really needs care and they present themselves at a hospital emergency room, the doctor and all the clinicians will provide that care.
Dr. Tippett?
You know, the problem we've got is that care has to be paid for, and it's being paid for by those who carry health insurance or have to pay or who pay out of pocket. So the cost of that care is already built into the system. It's
right.
Just that we pay for it in an uneven and haphazard way.
Right. Dr. Tippett.
Well, that's absolutely correct, and I want to say that it's not just the hospitals who have to bear this, it's the physicians as well. They're obligated to take care of the patients just as the hospitals are, and certainly they're happy to do that. That's not the issue. The issue is how is the system going to survive? How can we save money and make the whole system work and yet not go down the path of less care, rationing, and other problems which we see on the horizon if certain paths are taken, and that's the big issue here.
One of the big medical expenses we hear about, and I've heard vastly different numbers on this, has to do with defensive medicine. Dr. Tippett, defensive medicine, what exactly, well, I have an idea, but how would you describe it?
I would describe defensive medicine as ordering tests or procedures in which possibly the patient doesn't need the actual test or procedure, merely to try to protect oneself from being that 1 in 10,000 case who had a brain tumor who you didn't order a brain scan on, so you go ahead and get a brain scan on virtually everybody who has a mild headache. I mean, that's a perfect example of a huge cost of ordering a test that costs $1,000, $1,500 because somebody comes into my office and says, I've got a headache. If I don't do that and somebody does happen to have a brain tumor and shows up with that in 6 months, then I will likely be sued. So there's the Price Waterhouse just said, you may have seen the information, the accounting firm, that $200 billion a year is being spent on defensive medicine in this country. The medical associations didn't say that. Price Waterhouse said it, among others. The plaintiffs' attorneys frequently say, well, there's really not that much of the health care cost that goes to the liability issues. They count only that part which I pay for insurance, not this huge defensive medicine cost. If we're really serious about health care reform in this country, we need to do something to stop that huge expense to the system. $200 billion would pay a large portion of what we're trying to pay for.
But there's a technology, there's a whole system built around this sort of test ordering, isn't there? And the medical establishment, if we could call it that, has somewhat of an interest in using all this technology, doesn't it? Well,
you know, that's very interesting. I keep hearing that I get all this because I order these tests. Well, the fact of the matter is I get absolutely $0 when I order an MRI, a CT scan. I do not receive a penny for any of those tests I order. So to imply that it's just a reward for the physicians, I think is really bogus. Certainly there are some physician practices that do own, for the convenience of the patients frequently, some testing units, and they certainly do receive some reimbursement for that. But the large majority of neurosurgeons, for example, receive absolutely nothing for these tests they order, and they're certainly not trying to promote their system. They're trying to take care of their patients.
Okay, next question I have, and I want to ask David Apple Market about this, but first of all, to you, Bruce Rubin in Tallahassee, do you think, looking at the country as a whole, all the money we spend on health care that we're getting, our money's worth? Does America get a good value?
You know, there's so much variation in practice across the country that you know, it's not a hard conclusion to reach that we could be getting more value out of the money we put into health care. But I think it would be a mistake to look at some of these public health statistics that show America ranking below on things like preventable deaths and attribute that to an ineffective healthcare system. When you're really sick, this is the best healthcare you can get, is in this country.
Right.
So, you know, we can do better in terms of value, but healthcare in the United States is as good as it gets when you're truly ill.
Okay, good point. David, Apple, you're a healthcare consumer on a large scale with your business. You feel like you're getting your money, or your employees getting a good deal with the health insurance that you provide?
We have excellent health insurance, and it is expensive. It's at a premium price.
Is it a value? Is it a good thing?
I feel, well, we could elect a less expensive plan, but we've elected to go with this plan because it provides the best coverage. It is expensive, but we've just counted that as a cost of doing business, and have had to formulate ways to work around it. I mean, you know, until the debate is ultimately solved, you know, and you didn't ask me this question earlier, but I'm, you know, back to his point about $5 for an employee to be able to buy insurance, a young employee, and to try to insure everyone. Somewhere in the middle of that $5 and what we're paying right now is a way to streamline the processes enough to get the costs down to where at least many more people can be included and many more people can utilize the option to buy health care. Some of my employees, for example, don't buy the insurance policy that I have provided because they just can't afford it. It's expensive to me, but it's manageable on what they're making, but they have other things to do with their money, and so they elect not to buy it sometimes, and until they get to a point where they can, they just kind of suffer through. So I think somehow, you know, and I'm a retail guy and a market-based guy, and I believe that somehow or another the market reforms have got to take place, and the free market forces have got to figure out how to compete, how to sift out the costs. I mean, we have that capability among us. I think there may be some restrictions and limitations that are preventing that from taking place, and I'm not smart enough to know what those are. But I do have a very strong belief that taking out as much of the cost and making it as affordable to the common man as possible will enable more and more people to elect that coverage, and then you're always going to have a small portion that will elect not to take it, and those you find another way of dealing with.
All right. Todd Torgerson, same issue to you. We always hear about how much healthcare costs. It's about 1/6 of the national, the gross national product. Are we getting our money's worth? Does the United States have that great of a health system?
Well, clearly there are holes in it. I think the holes that are there can be patched without huge government bureaucracy. But on balance, I'm very, very thankful for the achievements that we've seen in healthcare. They're able to do a lot of things today that 20 years ago they couldn't accomplish. And I'm also very thankful for the quality of care that we have here in Pensacola. For a community of our size, it's just outstanding. So to me, yes, I think for the most part, we're getting a pretty good value, particularly given that the substantial majority of your healthcare premium dollars, which is what people are most concerned about, really, the substantial majority of that is made up by healthcare costs themselves. So people are getting the value back out of what they're paying in.
It's a funny deal, isn't it? Because practically everybody in the country thinks something ought to be done about the healthcare system. But when you get down to specifics and what that should be, the whole thing falls apart. And that's probably got to drive you nuts, Bruce Rubin, because you can see clearly from your point of view what needs to be done to get healthcare costs held down, and yet you got a lot of people who are going to argue something completely different.
Well, there's certainly waste and excess in healthcare in a system that is as big and covers such a wide array of services as healthcare does. You know, there are bound to be places to improve. We talked about two things this afternoon that get at reducing the growth and the cost of healthcare. Healthcare in the United States, healthcare anywhere, is always going to be expensive. But in terms of reducing the rate of growth, we talked about tort reform, which would eliminate the drive to order unnecessary tests and unnecessary services. That would be one step to take to reduce the rate of growth in healthcare. A second thing that we touched on that I mentioned earlier is to move away from volume-based payment in healthcare and move towards paying for outcomes and paying for best practices. And the more we can move towards that type of healthcare, that type of standardization at the highest level, the more likely we will be to make healthcare costs more predictable going forward.
It seems strange, doesn't it, that here we have in this country, you have so much medical technology, we have so much great information available. Every station is harping on it all the time, and yet we have become a society that's massively overweight. And healthcare costs would probably drop within reason tomorrow if people would watch their weight, watch their sugar intake, quit smoking, and do things that, stop doing things that are bad for them. And yet you can't go out and force people to change, can you? You have to deal with what you've got. A patient comes in to see you, they weigh 500 pounds, you obviously know they have to do something, but you got to treat them, right?
Well, absolutely, and it really makes our care for them much more difficult. If they knew the increased risk they were subjecting themselves to have neurosurgery, some of them, I think, would again try to take some personal responsibility, and I think that's something we have to keep harping on. You've got to be personally responsible for your health, or nothing's going to happen, no matter what the government says you have to do. And you may have heard in England they're requiring that children go to a class on learning to lose weight if they're obese. I mean, I would hate to see this country come to that sort of situation, but we have to be personally responsible, yes. And what Mr. Rubin said about outcomes, I think is an important issue in this country. That is, we look at the best outcomes. The problem that we are facing right now is, once again, the government is deciding frequently what those good outcomes are, rather than allowing the specialty societies, the American Medical Association, and other groups help determine what really are the best outcomes. They are arbitrarily deciding in many instances what these outcomes should be, and what the real risk there is that they decide that you should have this particular outcome, and if you don't do it this way, we're not going to pay for it. That may not be in the best interest of a particular patient, yet to save money, that's what we're faced with. So we need to be very careful about how we approach these outcome studies and those sorts of things. In terms of trying to save money and yet not ration care, which is a real risk.
Okay, about the testing, we agree the test costs a lot, but you say you order some tests that the patient may not need, but if it's my mother, my sister, brother, my child going in, you know, I'm going to want I want you to throw everything you got at the problem. So it's okay with me if somebody else doesn't get all the tests, but you know, if it's my family, I want all the tests. Isn't that kind of tough to deal with?
Well, sure it is, and most people that want all the tests want someone else to pay for it, and that's part of the problem. And I really agree that wellness is where it's at. You know, when you've got an insatiable demand curve for products and services that continue to go up exponentially in price, wellness and managing demand through wellness is really the only way to avoid rationing if we're going to stem the cost of healthcare increases. Otherwise, they're going to keep going up regardless of who pays the bill, whether it's the insurance companies, whether it's people, whether it's the government. It's not going to change unless we do something to positively influence demand. And getting control of our personal wellness is the way to do that.
Right.
Well, we already have rationing in healthcare in this country. I mean, if you have no health insurance, you have very little access to primary care. And so if you can't pay for that out of pocket, then the only time you're going to get health care is through an emergency room. And most people who have to get health care through an emergency room wait a long time before they seek it. And so when they do show up, they're already sicker than they would have been if they had had access to that primary care.
Now, Bruce Rubin, you brought up that word rationing, and with only a minute left in the program, I sure hate to hear that word bandied around, but we'll be hearing more about that. And you hear a lot of people say we already have rationing. It's people are kidding themselves if they think we don't have some form of rationing right now.
Well, they haven't seen anything yet.
These are the good old days.
It's going to be bad, particularly, I think, on the elderly population who will suffer rationing. All the health care plans I see, they're going to ration care to grandmother, my mother, your mother, me. In the very near future, they're going to decide that young person needs to get care under the currently proposed plans. And I think that's pretty sad, because that's not what I'm about in trying to take care of all of our patients.
Dr. Troy Tippett, President of the American Association of Neurological Surgeons, appreciate your being here with us today. Todd Torgerson, President of Combined Insurance Services in Pensacola. That's got to be a tough job, and I appreciate you making time to be here. And Bruce Rubin, Florida Hospital Association, thank you for your contribution. And David Apple, Apple Market, salute to you for being one of the businesses that wants to offer and do the right thing and offer health insurance to employees. So appreciate your participation. Thank you for watching. For WSRE, Lloyd Patterson here. Good night.